I am Wes Posvar. My wife Palmer is a 10th year dementia patient. 10 years ago, at the age of 54, she was at a family party and some of her family members said something was wrong and that she should see a doctor. And after a series of visits with a psychiatrist, followed by a neurologist, followed by cognitive testing and several different scans, she was diagnosed with something called frontotemporal dementia, which runs roughly 50-50 with early onset Alzheimer's for early onset dementias. For the first 29 years of our marriage, Palmer was a very active volunteer. Unfortunately, this diagnosis stopped her volunteer work in its tracks. And when you have a diagnosis like that, it's like your wife died that very day. You think, my God, there's nothing that's going to stop this. So in the early years of the illness, we tried to spend as much time together. We traveled with our family, we traveled together, and there came a point where I needed some help. So I started with a private caregiver, and shortly thereafter, I sought additional help for respite, and somebody had the wonderful suggestion that I put Palmer in daycare for a couple of days per week, and this would provide not only respite for me, but also acclimate her to the possible time that she would become a full-time resident. That was roughly 6.5 years ago, and later I needed to increase the number of days of daycare, which I did to 4, and then I also added a day with Presbyterian Senior Care at Home, which is another service provided by Presbyterian Senior Care, the parent organization. That worked well for another 3 or so years, and fortunately, Presbyterian Senior Care has the Woodside Gardens neighborhood at the Willows, which is the memory impaired floor for skilled nursing. If somebody came to me asking about Woodside Place for a loved one, for daycare or for residency, I would not hesitate to recommend it. I think one thing that I've observed, that I've also been told, is that many families wait too long. You don't need to wait until the resident needs full-time residency. You can start with daycare, and by acclimating that loved one to the environment, when the time comes for residency, the resident-to-be will know the staff, will know the other residents, and the transition is much, much easier.